Hi, everybody. Okay, here we go. Chapter 8. Hopefully, you guys have all got your CPT books, but we'll go through this and we'll see if I can clear the muck for this chapter. I hope you're excited because this is actually the beginning of looking at CPT and the major code set next to ICD-10 CM. So let's see what we got here. This is just in the introduction. So it's the basic brief explanation of CPT and things like that. So in chapter outline, we're talking about the history of CPT and the overview CPT, organization of CPT and such. This stuff can all be found in the front of your book of the CPT manual. In the introduction part of your CPT, it gives the full history. This is good information to know where to find this when you're taking the CPC exam. Okay, so kind of keep that in mind in case they ask you a historical question. You can go to the introduction section and you can look at it if you don't know the answer. Okay, and we're going to go through the layout of the book as well. Okay, so the current procedural terminology is what CPT is. We are looking at the newest version, which is 2021, which will be going into effect January 1st in the workforce. Okay. Keeping in mind that ICD-10-CM actually goes into effect October 1st of each year. So they do not go implement their new code sets the same time, which is kind of strange. I don't know why that is, but they don't. So, but and HCPC level 2 is actually January 1st as well. Okay. It's also called HCPC level 1. Just as an FYI, might want to write that down. HCPC level 1 is CPT in case that comes up too. Jot it down somewhere. Okay. This is the coding system that's actually created by AMA, which is American Medical Association. It's all the doctors. They are the ones that actually create, delete, revise codes. They have coding panels depending on the specialty units of the book that actually talk and discuss and implement changes to the book each year. If you would like to get something into the book, or a physician would like to get something into the book, say like a new code or something of that sort, they can submit it to the AMA panel, and then the panel will review it and determine whether or not they need to put it into the book or whether it might go into the temporary codes to determine its usefulness. Okay. Again, the history, again, can be found in the introduction of the CPT manual, but it's a 5-digit code set. It was introduced in 1970, so it's been around for a while. Adopted as part of the HCPCS for reporting medical Part B physician services in 1983. If we remember back in insurance, Part B is the physician codes, okay, the code sets. Mandated for reporting outpatient hospital surgical procedure in 1986, and HIPAA 1996 named CPT and HCPC level 2 as procedural code sets. So they became the authentic and the nationally known code set as of 1996, thanks to HIPAA. MMA 2004 required new revised deleted codes to be implemented each year on January 1st. Okay, now the people that use the CPT codes, those are the home health and hospice agencies. There are codes in there for those. There's outpatient hospital departments, physician employees by healthcare facilities, physicians who see patients in the office, clinic, or at home. Yes, they do home services now. They do home visits. If somebody is homebound or immune compromised, physicians will go to their homes. Okay. CPT categories, we got category 1 codes, which are the 5-digit codes, and those are the actual codes. Those are the permanent codes until otherwise stated. Permanent codes can be deleted, okay, because maybe something else is coming into effect because of it. So maybe a better approach or a better procedure has taken the place of that. So then therefore it will go away. Category 2 codes are actually measurement codes, and those are for quality purposes and for concurrent care issues, for chronic conditions such as weight issues, for obesity or diabetes, or blood pressure for heart conditions, that type of thing. So there are some measurement codes in there for that. Those do not have a price value on it, but you can actually code for them and then you can send it into the insurance to see if you can get reimbursed. Category 3 is a character code for emerging technology, and that are temporary codes. Okay, so it means that they're emerging, not sure if they're going to be used enough to be put into the permanent bracket. So they're kind of lingering out there. So they can stay out there for more than 1 year. They can be deleted or they can be moved to the permanent bracket if they've used it enough. Okay, CPT organizational characteristics. We got the CPT section, CPT code number format, bold-faced type, italicized type, cross-referenced terms, single codes and code ranges. We have guidelines in there, unlisted procedures and services. We have notes and descriptions and qualifiers. So there's all kinds of things in the CPT manual that you have to look at when coding. Okay, category 1 codes. We have, this is actually a list of all the sections and chapters in the category 1 code set, which is the permanent set. Okay, we have 6 sections. Evaluation and management is at the beginning, even though they're 9,900 codes. It's because this is the reason most doctors use these, except for anesthesia. So that's why they're there. Okay. And the next one is anesthesia, which starts with zeros. Okay. So that's their little quirk and their little specialty is that all of their codes begin with a 0. Nobody else's does. Okay. Surgery codes go from 10,000 codes all the way to 60,000 codes to the very end. And then we kick it into radiology, which is 70,000 codes, pathology, 80,000, and medicine, 90,000. Okay. So medicine has a lot to do with the diagnostic testing, procedures, and therapies, and things like that that take effect, such as psychology and things like that are in medicine section, and also heart, such as EKGs, ultrasounds, that type of thing. We got renal stuff in there in the medicine. There's all kinds of diagnostic studies that are in the medicine section. Category 2 codes, again, there are measurement codes to prove contributed to quality of patient care because of those chronic conditions. Their alphanumeric consists of 4 digits followed by a character of F. Okay, facilitate collections of information about quality of patient care. Now, these really come into play with when it comes to MACRA. I don't know if you guys remember MACRA, but it is a quality-based tool that they use to determine if physicians are actually giving quality care to patients with chronic conditions. So this measurement codes and category 2 codes are really vital to that. Okay, category 3 codes are temporary codes. Those are the ones that we're not sure if they're going to stay in the book. We're kind of testing them out and piloting them. They can be in there for more than 1 year. They're facilitated data collections on an assessment of new services and procedures during the FDA approval process. So they may not be generally approved. So that's why they're in the temporary mode. They will be retired and taken out within 5-year period if they haven't been used enough. CPT code number format, we have every CPT code has five characters. Most procedures and services contain a standalone description. To save space, some descriptions are indented. So we'll talk about the indented and how to read the book and what codes constitute the indentions. Okay. I know you're probably going, that's scary. No, it's not scary. It's really easy, so don't worry about it. CPT index organization by alphabetical main term. So the index in this book is in the back of the book, okay? And it's bold-faced, okay, for your main term. Procedural services and organs and anatomical sites, conditions, eponyms, and abbreviations are all main terms in the back of the book. Now, this is a little different than ICD-10. When you're looking at ICD-10, you're looking for disease, disorder, failure, things of that sort. In CPT index, you're looking for what is being done. Okay. So that could be an appendectomy, a fracture repair, lesion removal. Okay. Which then you're going to go to removal lesion skin and find your code. So it's a little bit more of a drill down in this book as far as finding your codes. Cross-reference, there's going to be some direction there. See, go to, watch those carefully and do exactly as it says, because it does map you to the right place to go if they have you going to a different place. Okay. Contains single codes and range of codes. Okay. So this is where you're probably going to need some scratch paper, because that way you don't have to flip back and forth trying to look at codes. There's nothing wrong with writing the code sets down of the ones that they give you. So that way it's a lot easier to go and find the codes that you're looking for. Inferred words do not appear in index. Okay. So this is a sample of a CPT index entry. So we have some cross references there. So if we have N meningitis, cross-reference terms, see Neisseria meningitis. Okay. We also have Nasberg operation, see decompression orbit section. So that's exactly how you would look. You'd go to decompression, then orbit, then that section. And then Nagel test would see color. So you would go to color vision examination is where you would go. So those are kind of how the cross references look. Okay, we have some appendices in the back of the book. Okay, located after the CP or the category 3 codes. You can look at those appendix for the complete issues of what they are. A is actually appendixes, deletions, and revisions. A complete list of code additions, deletions, and revisions are found in B. Okay, if you need them. Symbols. These are actually found in your introductory portion of your book as well in the coding manual, but symbols are used in order to understand how to read the codes and how to understand the code set. So for example, we have a bullet, which means it's a new code. Okay. Triangle 1 going upward is something that's a revised code. 2 triangles facing each other with the points, that is a revision of a descriptor. That's something inside the descriptor that has changed. The symbol with the circle with a line through it is exempt from modifier 51, which is you cannot use 51 for multiple procedures on that code. And we'll talk about that. Okay. So patient underwent emergency endotracheal intubation. This is a prime example. So with this one, you would want to do intubation. Where is it? Endotracheal. Okay. And it was an emergency. And then you find your code. You go to the front of the book, find the code, and check your code to make sure it's correct. Okay. With other procedures performed during the same encounter, do not add a modifier 51. This one has got the 0 with a line through it, saying that you cannot use that modifier with it. So it's a standalone code. Okay. Okay, I'm going to put it on hold just for a second. Okay, and I'm back. Okay, guidelines appear at the beginning of each CPT section. So the guidelines are usually, I think, in the green sheets of the CPT manual, right before the chapters. And then there's actually some guidelines that are embedded in these chapters, in these code sets that you might want to take a look at. And we'll talk about those too when we get to each section of the book. Okay. So examples of the section, subsection, category, and subcategory of the book. So chapters are basically, the sections are basically the major sections, which would be the chapters. We have 6 chapters or categories. Remember, evaluation management, anesthesia, surgery, radiology, pathology, and medicine. Okay, so those are your section categories. Okay, or sections. Your subsection is the section that's underneath there. So, for example, surgery starts with integumentary. So the subsection would be integumentary. Okay, then we go to the category, which we have hair, skin, and nails in there. So is it the skin? Is it the nails? There's all kinds of places for categories that you can go. So that's an example. If it's a trickle down to, first you have your section, which is the surgery section. Then you have, in the surgery section, you have the organ system of integumentary. And from there, we are looking at the skin, which that's a category. And then the subcategory would be what you're doing, which in this case, your approach, incision, and drainage. You could do a repair, you could do removal, you could do all that stuff. That would be your subcategory. Okay. Um, Again, you might want to make this is a really good example of how to descript what section, subsection, category, and subcategories mean. So I strongly suggest that maybe, if anything, print this slide so you have as a reference tool. If you can't remember it, by all means, you can put it in your book somewhere in your 2021 CPT manual if it helps you out. Yes, you can write in your manuals. You just can't glue, staple, or tape anything in there. But any notes that you put in there that you think are relevant, that are important, by all means do so. I strongly suggest when people do the CPT class, this one here, that you get a book, a spiral notebook or a notebook, and you make notes. And then after you make the notes, you go back and take a look. Do I need to put that in the book? Am I going to remember that? Is that something that I need to put in there? So this is one of those things. I would write it down, or I would take a copy of this slide and kind of review it. And if you think you need to put it in the book, you can put it in the book, okay, in your CPT manual. Okay, CPT modifiers clarify services and procedures performed by the provider. It adds additional information that could possibly potentially get extra money. It also helps for physicians to get paid for other services. For example, modifier 25. Modifier 25 is used for evaluation and management so that you can get paid for services such as ear lavage or cryosurgery for a wart, things like that, on the same time as a service for something else. Okay. HIPIC level 2 national 2-character alphabetic modifiers are actually in there too, that you can use in these codes too as well. And remember, we marked that in the HIPIC book. Okay. Functions and informational modifiers. Functional modifiers, also called pricing modifiers, assist in reimbursement decision making. There is example of issues with 22, an extended service beyond what is normal, could get you some more money, that type of thing. Informational modifiers clarify aspects of procedure service provided to the payer, such as RT and LT. Which arm did you do it on? Which finger did you do it on? Is it the left hand or the right hand? That type of thing. Or is it which digit? And we do have ones for fingers in there too. They're F modifiers, and they are in there too that just descript which finger, which hand. Okay. All right. National Coding Initiative. We talked about this in the insurance class, and the National Correct Coding Initiative is actually a software system that helps you to correct code so you do not get in trouble. Okay, so it's implemented by CMS, and it has criteria in there for CMS for Medicare. So sometimes it might come up as a Medicare rule, and you might have to overwrite it, especially when it comes to those G codes that we talked about in chapter 7 when we talked about those G codes in the HCPCS level 2 book. If the carrier does not take those G codes, then you have to substitute that code with something else. So, but this is a good tool that most people use to help with eliminating errors in their coding and before they submit. These are some of the edits that actually come up when it comes to NCCI. We have invalid diagnosis code. That could be because you didn't code to the fullest extent. Diagnosis and age is a conflict, maybe because it's a pap smear and it's a 2-year-old. All right. Diagnosis of sex conflict. Okay. Let me think. A pap smear on a male could be a problem. Medicare secondary payer alert, those type of things. Mutually exclusive procedures that is not allowed by CCI. Components of comprehensive procedures, mutually exclusive procedures, and components of comprehensive procedures. Those are just some of the ones that they see a lot. Types of NCCI edits. We have columns 1, column 2 edits. Codes pairs should be billed together because one service inherits includes the other. Mutually exclusive credit, we're just not going to deal with that. Unbundled services. Now, unbundled services when it comes to NCCI edits are very important because if there's one code that has everything included, you should be coding that code. NCCI will tell you that you cannot unbundle this code, but it's included with this code. So that's a nice feature about NCCI. And that is it that I have for that. Wow. Okay. Um, nice introduction. Okay, so I'm going to briefly explain to you on how to use the book. Now, go to the back of the book, look at this is your question you're asking yourself. What am I doing? Okay. What am I doing? Is it a repair? What is it? And then from there, you find the body organ system. What body organ surface are you looking at? And then after that, what is the approach? Is it Am I doing it laparoscopic? Am I doing it incisional, excisional? What is my approach? Okay. And then you can actually find your code set. So I know this sounds a little tricky and it might be a little confusing, but once you get back there, there's not a lot of options in some of them there are. So if you look at repair, and you can repair a lot of things in the body. So if you're doing a lesion, which we're going to be getting into the skin section, lesions are skin, so you would go removal skin, and from there it gets a lot easier because then you go to the body part of where that skin is, and then you actually look at simple, intermediate, or complex. Okay, so and the note will tell you that. Okay, so and we'll look at the modifiers when we have to use them. Keep very close attention to the issue that we have behind um, extremities. We have a left, right, arm and leg, ears, okay, eyes. So it could be left or right. Um, Toes, there's fingers and toes in there for modifiers, and it's found in the front panel of your CPT when you first open the book. It's on the hard copy. Just as you open the book, you'll see it. It's the first, it's on the flap on the inside, and you'll see the list of all the modifiers. And the ones we're looking at are on the second column. Actually, they're on the first column and most of the second. Okay. So take note of those modifiers because every once in a while we'll have to use them. And I'll try to remind you to say, I'll kind of give you a hint like, hey, there might be a modifier on this one. You might want to take a look at it. So that way I can give you a heads up. Okay. I will be looking through your homework this week and see if there's any tricky stuff that you need help on, and I'll try to give you guidance on it. Okay, to get you started and get you going. But it should be a fairly easy week this week because we're just doing the introduction stage. Okay, so if you have any questions, let me know. But hopefully this has helped. Okay, I'll talk to you soon. Bye.